Chief Medical Officer Dr. Sharon Belmar-George highlighted the critical statistics driving the 2025 focus, emphasizing that most diagnoses occur in the 45 to 55 age bracket. The initiative aims to empower citizens, particularly young women, with the knowledge and resources to take proactive steps against the disease. Dr. Belmar-George stressed the severity of breast cancer, noting its global prevalence and alarming local impact.
Globally, there were 2.3 million women diagnosed with breast cancer and 670,000 deaths in 2022, making it the most prevalent cancer in the world. Breast cancer was the most common cancer in women in 157 countries out of 185 in the year 2022. Approximately 0.5 to 1% of breast cancers occur in men. Over the past 5 years, breast cancer has consistently ranked as the second leading cause of cancer-related deaths among women. In 2023, it emerged as the primary cause of potential years of life lost among women aged 25 to 44, accounting for a total of 543 years lost. Notably, breast cancer represented 8% of all female cancer deaths in 2022, rising sharply to 18% in 2023.
The disease is not just affecting older populations, it's robbing St. Lucia of its young female workforce.
According to the National Epidemiology Unit within the Ministry of Health, in 2025, invasive ductal carcinoma continues to be the #1 cause of death in women and the main cause of premature death in women. Most of these diagnoses are made in women from the age group 45 to 55 years. The risk of breast cancer is increased due to aging of individuals, obesity, harmful use of alcohol, family history of breast cancer, history of radiation exposure, reproductive age, that is, the age of first menstrual period and also the age at first pregnancy, tobacco use, and postmenopausal hormone therapy. Approximately half of breast cancers develop in women who have no identifiable breast cancer risk other than gender, that is female, and also age over 40 years of age. The symptoms of breast cancer can include a breast lump or thickening, often with pain, changing the size, shape, or appearance of the breast, dimpling, redness, pitting, or other changes in the skin, change in the nipple appearance or the skin surrounding the nipple.
The ministry's 2025 campaign, with the sub-theme Embrace Your Whole Self, Check Your Limits, will focus heavily on modifiable risk factors. This includes engaging young ladies aged 15 to 50. To remove barriers to early detection, Dr. Belmar-George confirmed that access to screening has been centralized and made cost-free to the public.
In order to encourage cancer screening, mammography services can be accessed through any of our primary healthcare facilities, that is the community wellness centers, the polyclinics, and the district hospitals. Individuals will then be guided to the St. Jude Hospital and the Millennium Heights Medical Complex to get the mammogram done at no cost. Also, mammogram vouchers funded by the Ministry of Health will continue to be provided at outreach activities undertaken in workplaces and in communities. This October, we invite you to join the Ministry of Health in reducing the impact of breast cancer by doing the following. Maintain a healthy lifestyle, eat healthy foods, exercise regularly, get adequate sleep, reduce stress, reduce alcohol intake, and avoid smoking. Visit your nearest wellness center to access screening. Learn to perform a monthly breast self-exam. Our team at the nearest wellness center or your physician could provide guidance.
The ministry urges all citizens to participate in Pink Fridays throughout October and adopt key preventative measures, including maintaining a healthy lifestyle, performing monthly breast self-exams, and encouraging loved ones to get screened.